Good morning, everyone. I am Annalyn Orhin and I will be reporting about gender dysphoria together with Miss Christine Okoy. So, this is our topic outline. First is the terminologies. Under that is the sex and sexual, gender assignment, assignment, gender affirmation treatment, gender identity, transgender, cisgender, and transsexual. So, next is the what is gender dysphoria, the etiology, the diagnostic criteria, the difference in sexual development. Under that is what is DSD, types of DSD, gender dysphoria with DSD, gender dysphoria without DSD. And next is the prevalence, comorbidity, and treatment. So, let us first discuss the different terminologies here in gender dysphoria to better understand this report. So, first is the sex and sexual. So, sex and sexual refer to the biological indicator of male and female or understood in the context of reproductive capacity such as in sex chromosomes, gonads, sex hormones, and non-ambiguous internal and external genitalia. So, ibig sabihin, ang sex and sexual, ito yung nagtatakda ng pagkakaiba ng babae at lalaki. So, gaya ng male and female reproductive organ, ang pagkakaroon ng menstruation ng mga babae. Tapos, mas malaki yung pulso ng mga lalaki kaysa sa mga babae. At panghuli ay ang pagkakaiba ng hormones and chromosomes ng both sexes. So, yun siya ang sex and sexual term. So, next is the gender. Gender is used to denote the public socio-cultural and usually legally recognized or live roles as boy or girl, man or woman, or other gender. So, tumutukoy ito sa mga gampanin at gawaing nakatakda para sa mga babae at sa lalaki sa lipunan. So, ang katangian ng mga gawain sa lipunan ay kung ang hanap buhay ng mga mamamayan na hindi nakabatay sa sex ng bawat isa. So, halimbawa, di ba halos ng mga gawaing bahay ay ginagawa ng mga babae. So, yun siya ang nagre-represent ng gender, which is socially or social role siya na tawag. And next is the gender assignment, which is referred to the assignment as male or female. So, ito yung classification ng isang babae sa lalaki gaya ng pagkakaroon ng reproductive organ, sabi ko kanina. And next is the gender reassignment. So, it denotes an official and sometimes legal or change of gender. So, dito nag-refer na nag-refer to siya sa mga transgender na nag-under na sa process of changing his or her sex organ. So, yun siya ang tawag sa gender reassignment. Next is the gender affirming treatment. So, it is a medical procedure of hormones or surgeries or both that aim to align an individual's physical characteristic with their experience gender. So, it is the primary intervention primary intervention to conduct a procedure para mapalitan yung sex organ ng isang tao. So, next is the gender identity. So, this gender identity refers to an individual's identification as male, female, some category in between, or example, the gender fluid, or a category other than male or female. Example, the gender neutral. So, dito is ito ay personal na pagkakakilanlan ng isang lalaki at babae sa kanyang sarili. So, maaaring yung biological na sex ng isang lalaki ay yung biological sex ng lalaki is inuuri siya sa kasarian bilang isang babae or iba pa. So meron ding ibang babae na kilala nila yung sarili nila na isa sila sa mga lalaki, or meron din iba na parehong lalaki at babae ang nararamdaman nila. So, yung gender identity is kung ano yung nararamdaman ng isang tao sa loob niya. For example, ako, isa akong babae, pero yung gusto ko or yung sa loob ko is isang lalaki. Gusto ko maging lalaki. So, yun siya ang gender identity, yung nagre-represent ng pagkakakilanlan ng isang tao sa kanyang sarili. So, next is the transgender. So, it refers to the broad spectrum of individuals whose gender identity is different from their birth assigned gender. So, ito yung mga tao na hindi nila feel na tugma yung biological sex nila sa nararamdaman nila or sa gender identity nila. They dress according to sa kung anong gusto nila without thinking their biological sex, because yun yung nararamdaman nila. For example, mas gusto ng isang lalaki na magdamit at gumalaw gaya ng isang babae. So, ibig sabihin, transgender yun siya kasi he dress like how women dress. So, yun siya transgender. So, next is the cisgender. So, it describes individuals whose gender expression is congruent with their birth assigned gender. It is also called the non-transgender. So, ito is kung ano yung biological sex nila is equal sa gender identity nila. Like, for example, yung isang tao is, yung gender identity niya, yung biological sex niya is isa siyang babae since birth. So, yung gender identity niya naman is nakatugma sa biological sex niya, which is babae. So, yun siya ang cisgender. So, kung yung isang babae or lalaki ay nag-undergo ng medical procedure, like umiinom sila ng gamot para ma-change yung hormone nila, like pampalaki ng dede or plastic or nag-undergo sila ng plastic surgery para ma-change yung body nila sa preferred gender na gusto nila. It means ang tawag dun sa kanila is transsexual. So, transsexual is a historic term, denotes an individual who seeks or undergoing or has undergone a social transition from male to female or female to male. So, dito sa transsexual is nag-undergo na sila ng medication para ma-change yung biological sex nila, like para ma-change yung tawag doon yung reproductive organ nila sa gusto nilang sa mas prefer nilang gender. So, yun siya ang transsexual. So, let's proceed to the gender dysphoria. So, what is gender dysphoria? So, gender dysphoria is ito yung feeling of distress. Sabi nga dito, as a general descriptive term, refers to the distress that may accompany the incongruence between one's experience or expressed gender and one's assigned gender. So, ito yung feeling of distress and discomfort ng isang tao na na-experience na hindi tugma yung gender niya sa kanyang gender identity, 'di ba? 'Di ba nasabi ko kanina yung difference ng gender ng mga words na gender identity. So, I hope na-gets niyo yun siya. And people with this with gender dysphoria may nakaka-experience ng severe emotional and psychological distress kung hindi nila na-express yung totoong gender na nafe-feel nila at kung wala silang nakukuhang support and acceptance sa mga taong pinagsabihan nila. Kaya merong iba na takot, 'di ba? Merong iba na takot na sabihin kung ano yung gender identity nila kasi takot din silang ma-discriminate ng ibang tao. Kaya nagkakaroon ng distress na tinatawag na gender dysphoria. So, um, gender dysphoria is listed in the Diagnostic and Statistical Manual of Mental Disorder, which is called DSM-5. So, yung gender dysphoria noon is tinatawag siyang gender identity disorder. Pero, noong 2013 is binago yun siya to remove the stigma associated with calling it a disorder. So, kung saan, di ba dati, tinatawag ito na disorder-related identity. So, parang sinasabi na kapag nakaka-experience ka ng ganitong distress, is may disorder ka na. Kaya, in DSM-5, it takes more descriptive approach that is focused on the discomfort and distress that dysphoria causes. So, para maiwasan yung stigma na yun is change ng DSM-5 yung gender identity disorder into gender dysphoria para mawala yung stigma na tinatawag na kapag nakaka-feel ka ng incongruence sa gender mo, may disorder ka na. So, yun siya yung dahilan kung bakit binago yung yung gender identity disorder sa gender dysphoria. So, let's proceed to the etiology of gender dysphoria. So, we have here the two factors that causes gender dysphoria. First is the biological factors. Masculinity, femininity, and gender identity may result more from postnatal life events than from prenatal hormonal organization. The testosterone can increase libido and aggressiveness in women, and estrogen can decrease libido and aggressiveness in men. And no one knows exactly kung ano yung causes talaga ng gender dysphoria, pero some experts believe that the hormones or that hormones in the womb, genes, and cultural and environmental factors may be involved. So, they believe na meron talagang problema sa genes ng isang tao kung kaya nakaka-cause ito ng gender dysphoria. So, next factor is psychosocial factor. So, the formation of gender identity is influenced by the interactions of children's temperament and parents' qualities and attitudes. So, maybe yung gender identity ng isang bata is na-influensyahan ng nasa paligid niya. Like for example, if yung bata is napapalibutan ng mga babaeng kalaro, mga babaeng tiyahin, so akala niya yung ginagawa ng mga babaeng iyon is tugma sa gender niya, which is hindi. So, nagkakaroon siya ng gender incongruence dahil sa influensya ng nasa paligid niya. So, next is the culturally acceptable gender roles exist which are learned. So, boys are not expected to be feminine and girls are not expected to be masculine. There are boys games, example cups and rubbers, and girls toys, example dolls and dollhouses. So maybe yung gender ng isang bata is dahil sa mga bagay-bagay na natutunan niya sa kanyang paligid. Kaya nag-iiba yung gender identity niya. So, last is the childhood conflict. So, first is the mother and child relationship, the mother's death, and the separation individuation process. Next is the DSM-5T or Diagnostic Criteria of Gender Dysphoria in Children. So, that gender dysphoria in children is marked incongruence between one's experience or expressed gender and assigned gender of at least 6 months duration. So, remember this. at least 6 months duration as manifested by at least 6 of the following, or one of which must be criterion A1. So first is a strong desire to be one of the other gender, or an insistence that one is the other gender, or some alternative gender different from one's assigned gender. So mas gusto nila yung another other gender kaysa sa gender na meron sila ngayon. So next is the boys assigned gender, a strong preference for cross-dressing or simulating female attire, or in girls assigned gender, a strong preference for wearing only typical masculine clothing and a strong resistance to the wearing of typical feminine clothing. So, sa mga boys, mas gusto nila yung magdamit na pambabae kaysa sa damit na dapat panlalaki. Kasi yun yung feel nilang suotin at bagay sa gusto nila, sa gender identity nila. And sa mga girls naman is mas gusto nila yung mga masculine attire or yung mga damit panlalaki, kasi parang feeling nila is cool sila tignan pag ganun, kasi yun din yung gender identity nila. So next is a strong preference for toys. For the toys, games or activities stereotypically used or engaged in by the other gender. So mas gusto nila yung mga laruan na nilalaro ng opposite gender nila. Like for the boys, mas gusto nila maglaro ng Barbie dolls, mga manika-manika, so ganon. And sa mga girls naman is mas gusto nila maglaro ng mga toy car, mga baril-barilan. So yun yung mas gusto ng mga bata na may gender dysphoria. So next is a strong preference for playmates of the other gender. So mas gusto nilang kalaro yung mga opposite gender nila. Like sa girls, gusto nilang makalaro yung mga lalaki. Tapos sa boys naman, mas gusto nilang kalaro yung mga babae. So yun siya. And next is the boys or assigned gender, a strong rejection of typically masculine toys, games, and activities, and a strong avoidance of rough and tumble play. And girls are also a strong rejection of typically feminine toys, games, and activities. So nire-reject nila yung mga laruan na pang boys. Like for example, sa mga boys, nire-reject nila yung laruan na pang boys. Like sa mga baril-barilan, ayaw nila yun. Mas gusto nila kasi yung bahay-bahayan, like maglaro ng Barbie dolls. So ganon yung gusto ng mga children na may gender dysphoria. And next is a strong dislike of one's sexual anatomy. So ayaw nila yung reproductive organ na nila, kasi mas gusto nila yung reproductive organ na equal sa gender identity nila. But still they are born na, like for the boys na pinanganak sila na may male reproductive organ, pero mas gusto nila yung magkaroon ng female reproductive organ. So next is a strong desire for the primary and secondary sex characteristic that match one's experience gender. So yun nga, mas gusto nila yung opposite gender na feel nila, kasi yun siya ang parang identical sa gender identity nila, even though iba yung biological sex nila. And sa B, the condition is associated with clinically significant distress or impairment in social, school, or other important areas of functioning. So nagkakaroon ng distress and impairment yung mga bata in schools, in social, or sa paligid nila, sa schools, and sa mga areas na kung saan sila, or sa mga paligid na, or sa mga nakakahalubilo nila. And specify if with a disorder or difference of sex development, example, the congenital, androgenital, disorders such as E25.0 congenital adrenal hyperplasia or E34.50 androgen insensitivity syndrome. And the coding note is the disorder or difference of sex development as well as gender dysphoria. So the next slide will be reported by my colleague, Miss Christine Okoy.
So let us now proceed to the criteria of gender dysphoria in adolescents and adults. So letter A marked incongruence between one's experienced or expressed gender and assigned gender of at least 6 months duration as manifested by at least two of the following. First, a marked incongruence between one's experienced or expressed gender and primary or secondary sex characteristics. Second, a strong desire to be rid of one's primary and secondary sex characteristics because of a marked incongruence with one's experienced or expressed gender. Third, a strong desire for the primary and or secondary sex characteristics of the other gender. So an organism's primary sexual characters are its reproductive organs or the penis and vagina, and their gametes or the sex cells, which is the egg cells and sperm cells. And an organism's secondary sexual characters include all other structural or visual differences such as mammary glands, muscular development, plumages, and behavioral patterns that do not figure directly in the reproductive act. So, for example, for males, the secondary characteristics include their facial and chest hair, the pelvic build or lack of rounded hips, the upper body muscular build, and the ability to generate muscle mass at a faster rate than the female. While the female's secondary sex characteristics include relative lack of body hair, rounded hips or figure, the decreased upper body strength, forming of breasts and menstrual cycle, and increased body fat composition. Fourth, a strong desire to be of the other gender. Fifth, a strong desire to be treated as the other gender. And lastly, six, a strong conviction that one has the typical feelings and reactions of the other gender. And letter B, the condition is associated with clinically significant distress or impairment in social, occupational, or other important areas of functioning. So let us specify first if with a disorder or if it is with a disorder or the difference of sex development. So the code E25.0 congenital adrenal hyperplasia or the CAH is a genetic disorder in which the two adrenal glands, which is located at the top of the kidneys, do not function properly. CAH is caused by genetic defects in the proteins and enzymes involved in the cortisol biosynthesis, while the code E34.50 or the androgen insensitivity syndrome or AIS is when a person who is genetically male is resistant to male hormones. As a result, the person has some of the physical traits of a woman but the genetic makeup of a man. Specify if the post-transition or the individual has transitioned to full-time living in the experienced gender or has undergone at least one gender-affirming medical procedure or treatment regimen, maybe either breast augmentation surgery or vulvovaginoplasty, and in transmasculine chest surgery or the phalloplasty or the metoidioplasty in an individual assigned female at birth. So, if ang adolescent and adults nag-experience ng incongruence between sa kanilang assigned gender and their expressed gender, and if it lasts 6 months, and if nagmanifest sila ng at least dalawa sa mga criteria, then it is possible that they are diagnosed as having the disorder na ginatawag natin na gender dysphoria. Individuals with difference in sex development, or DSD, formerly known as intersexuality, can also experience gender dysphoria. Individuals with DSDs are typically assigned to a specific sex at birth, infrequently undergoing surgery to change their sexual anatomy depending on their unique combination of characteristics. So, what is DSD, or the difference in sexual development? So it is a group of rare conditions involving genes, hormones, and reproductive organs, including genitals. It means a person's sex development is different to most other people. So a DSD is a mismatch between a child's genetic structure or chromosomes and the way their genitalia appear. The onset of a DSD in a child can occur in infancy, childhood, or adolescence. DSDs were formerly referred to as intersex disorders. It could be a difference in genes, a difference in how an individual responds to sex hormones in their body, or a combination of the two. Although it can be inherited, there is frequently no clear cause. Around the time of a person's birth or when they are in teenager, it is when the most typical to learn that they have a DSD. And sometimes the term is used as disorders of sex development or variations in sex characteristics, or VSC, and diverse sex development. So next slide. Hermaphroditism. It is the condition of having both male and female reproductive organs. Intersex is a group of conditions in which there is a discrepancy between the external genitals and the internal genitals, or the testes and ovaries. Next is the pseudohermaphroditism, or it is a person whose gonads are consistent with the chromosomal sex but who has external genitalia of the opposite sex. So, another types of DSD are, first, usual female pattern genes with genitals that look different to girls' genitals. Some people have XX chromosomes with ovaries and a womb, but their genitals may not look the same as many females. For example, if the child is female, the raised androgen levels before birth can cause their genitals to look different, such as a larger clitoris and a vagina that is not open in the usual place. Second, ordinary looking genitals but different sex development. One type is Klinefelter syndrome, which is where a boy is born with an extra X chromosome. This can mean that they do not produce the usual level of testosterone, which is the sex hormone is responsible for the development of male characteristics such as the testes and body hair. And lastly, genes usually seen in males with genitals that look the same as most girls and some internal male structures. Some people have XY chromosomes, but their external genitals may develop in the usual way for girls and boys. So sometimes it is difficult at first to know whether their genitals are more similar to girls or boys. So a person may have a womb and may also have testicle inside their body. Sometimes the testicle might not work properly, but for some, the scrotum appears separated into two smaller sacs and one on other side. Men with this DSD can have either fully developed or partially developed testes. So, among all of the mentioned types of DSD, or disorder of sex development, we also have here the gender dysphoria in association with a disorder of sex development. So affected individuals may exhibit gender nonconforming behavior starting in early childhood in a manner that is predictable depending on the specific DSD syndrome and the gender assignment, and thresholds for supporting social and medical gender transition in minors have traditionally been much lower for those with compared to those without DSDs. So late onset of pubertal or post-pubertal onset gender dysphoria occurs around puberty or even much later in life. That is why some parents of individuals with gender dysphoria of pubertal or post-pubertal onset often reports surprise as they saw no signs of gender dysphoria during childhood. And next, gender dysphoria without a disorder of sex development. Individuals with prepubertal onset gender dysphoria have symptoms that meet diagnostic criteria for gender dysphoria in childhood. The dysphoria can continue into adolescence and adulthood. Alternatively, some individuals go through a period in which the gender dysphoria either desists or is denied. So, at such times, these individuals may self-identify as being gay or lesbian. Some may identify as heterosexual and cisgender. However, it is possible that some of these individuals may experience a recurrence of gender dysphoria later in life. And when diagnosing a DSD, it should be noted if gender dysphoria manifests in the patient. However, the majority of people who experience gender dysphoria don't have any obvious physical anomalies.
This diagram represents the multi-sense theory of gender dysphoria. So the overall sense of gender in an individual is modeled as a neurobiological and the reflexive sense, integrating information from multi-sense and stimuli, which is, you can see the bold arrow, and the sense of gender is framed relative to gender assigned at birth. Or example, am I the gender that was assigned at birth, and rather than an absolute male or female dichotomy, or am I a female? So yun siya. And each of the three listed reflexive senses, which is the here the violet boxes, relate to a specific dimension of diagnostic criteria for gender dysphoria, as well as a matching function network with nodes known to be altered in transgender individual. And the interaction between senses of gender and these three reflexive senses may be bidirectional. External factors, which is you can see in the green boxes, influence the sense of gender either directly to, which is this bold arrow, via affecting the reflexive senses. So the model can also be extended to include additional internal and external factors. So that this diagram represents a dynamic network, not a specific causal pathway, and includes potentially reflexive interactions and feedback loops. So as you can see in the neurobiological reflexive sense, so the three boxes, which is nakalagay dito yung sense of distress, which is connected din siya sa sense of gender. So we have here the prevalence of gender dysphoria diagnosis across populations has been assessed to be less than 1/1000, or less than 0.1% for both individuals assigned male at birth and individuals assigned female at birth. In children, so yung ratio ng natal boys to girls, nag-range siya sa 2:1 and to 4.5:1. And yung sa adolescents naman is close to the parity or equal. In adults, the sex ratio favors natal males, worth ratios ranging from 1:1 and 6.1:1. And the self-identification as transgender ranges from 0.5% to 0.6%, experiencing oneself as having an incongruent gender identity. So, yung mga taong hindi tugma yung gender identity nila is ranges siya from 0 to 6% to 1.1%. So, feeling that one person is a person of a different sex ranges, or yung mga tao na feel nila nasa different sexes sila, is nag-range sa 2.1% to 2.6%. And yung mga tao naman na nagdi-desire na mag-undergo ng medical treatment is ranges from 0.2% to 0.6%.
So in comorbidity, in adults, lifetime rate of suicidal thoughts in the transgender people is about 40%. In children, the reason why children have behavioral and emotional problems because to the increasing non-acceptance of gender variant behavior by others. Clinically preferred children with gender dysphoria show elevated levels of anxiety, disruptive, impulsive control, and depressive disorders. Autism spectrum disorder is more prevalent in clinically referred adolescents and adults with gender dysphoria than in the other general population. So, in children, some researchers find that the children tend to fall in the autism spectrum disorder as well. So, diagnosing gender dysphoria in people with autism spectrum disorder can be difficult. It can be challenging due to the concrete and rigid thinking about gender roles and or poor understanding of social relationships that are characteristics of autism spectrum disorder. It is important to distinguish potential co-occurring gender dysphoria from an autistic preoccupation. Next is in adolescents and adults, increased rates of anxiety and depression also have self-harming activities, suicidality, and substance abuse. Individuals who experience gender dysphoria are more likely to have suicidal thoughts and attempt suicide. Adjustment varies after gender-affirming therapy, and while coexisting symptoms improvement is frequently noted, some people continue to have prominent anxiety and depressive symptoms and remain at higher risk of suicide. Also, in some non-Western cultures, anxiety has been found to be relatively common in individuals with gender dysphoria, even in cultures with accepting attitudes towards gender variant behavior. Let us now proceed to the treatment. So in children and adolescents, the treatment of gender dysphoria in children is directed largely at developing social skills and comfort in the expected by birth anatomy. To the extent that treatment is successful, transsexual development may be interrupted. So in some schools, children are being allowed and even encouraged to dress and appear in gender non-conforming ways on the assumption that gives freer reign to who they really are. So other intervention exists to build resilience in children with exhibit gender nonconforming behavior by strengthening their relationships with peers and caregivers, increasing their self-control, and increasing their sense of belonging within the community or culture. And parents must also be informed. The goal of family intervention is to keep the family stable and to provide a supportive environment for the teenager or child experiencing gender dysphoria. So, the goal, which is watchful waiting, or by letting expressed gender unfold naturally, requires strong support from caregivers and the community because of the potential social and interpersonal risks and lack of integration with peer groups. So the treatments in adults patients coming to a gender identity clinic usually present with straightforward request for hormonal and surgical sex reassignment. When patients' gender dysphoria is severe and intractable, sex reassignment may be the best solution. So in this part, we will discuss the different treatment for adults who experience gender dysphoria, and the first treatment is the sex reassignment surgery. So for a person born anatomically male consists principally of removal of male genitalia and construction of labia and vaginoplasty. Individuals must be certain if they want to change their sex by living with the desired gender for at least 1 to 2 years prior to having the surgery. In addition, they need to be stable in their financial, psychological, and social lives. Contrarily, it was found that between 1% and 7% of people who underwent sex reassignment surgery had some regret about the procedure. So, dito, ginasabi na dapat before sila magpa-surgery, dapat i-leave muna nila ng 1 to 2 years ang desired gender nila prior to have the procedure na reassignment. Sa female to male naman, patients typically may undergo bilateral mastectomy or the surgical removal of both breasts to treat or prevent breast cancer, and construct neophalus or surgically constructed penis made from tissue grafts taken from other parts of the body. Because of increased technical skills in phalloplasty, more female to male patients are now electing these procedures. So, lastly, the intersexuality or the treatment for disorders of sex development. These procedures usually take place soon after birth. So, surgery depends on the type of DSD. For some, surgery may be needed, and for others, it may be an elective or optional procedure. So, if the DSD or the rare condition involving genes, hormones, and reproductive organs, including genitals, occur after birth, then the surgery must take place soon as it was noticed. So next is restore functionality or potential functionality, generally before age 3. So surgery replacement therapy has been standard treatment for many individuals with DSDs who may be born with physical characteristics of both sexes in order to make their sexual anatomy match as closely to their assigned gender as possible. So that's all for my report. I hope you have gained lessons or knowledge about the disorder, which is the gender dysphoria. So, good day and have a blessed week to everyone.